Hi, my name is Mishel, and I will be presenting on Merle Mishel's uncertainty and illness theory. I'll start with a little bit of background on the theorist, and then I'll go into the theory itself and share my thoughts on it. So Merle Mishel was born in Boston, Massachusetts. She started her education there as well. She received a bachelor's degree and a master's degree in psychiatric nursing from Boston University. She then moved to California and continued her education over there, receiving a second master's degree and a PhD in social psychology from Claremont Graduate School. She began working as a professor in California, later taking a job in Arizona, and eventually moving to North Carolina, where she's been working at the University of North Carolina in Chapel Hill. Mishel was also inducted into the Nurse Researcher Hall of Fame back in 2011. So let's look at the theory itself. So uncertainty and illness theory focuses on the mindset of somebody after they've been diagnosed with an illness. And it determines how well they're coping with the unknown changes and uncertainty that the disease introduces into their life. Mishel outlines key concepts that are integral to the theory. I'll go over the key concepts now. So uncertainty being the most important of them. And she defines it as the inability to determine the meaning of illness-related events occurring when the decision maker is unable to assign definite value to objects or events, or is unable to predict outcomes accurately. And this is going to be more evident earlier on, closer to diagnosis, as opposed to further on when somebody that has been dealing with a chronic illness for a very long time. But it never goes away. There's always going to be a level of uncertainty. Cognitive schema is a person's subjective interpretation of illness, treatment, and hospitalization. And the stimuli frame looks at the form, composition, and structure of stimuli that a person perceives, which are then structured into a cognitive schema. And examples of these are symptom pattern, which is the degree to which symptoms occur with sufficient consistency to be perceived as having a pattern or a configuration. And this leads to event familiarity. And that's the degree to which situation is habitual or repetitive or contains recognized cues. The event congruence is the consistency between the expected and the experienced in illness-related events. Structured providers these are concepts that refer to things that are outside of the person. You have credible authorities, you have social supports. Credible authorities are hopefully us as healthcare providers are being credible authorities, and that's where we give the patient a sense of trust and confidence in us to help guide them through this disease process. Give them information that is going to help them feel at ease with changes that are happening in their life due to these due to the symptoms of the illness. Social supports, family members, friends, and ideally they are going to influence uncertainty by assisting the individual to interpret the meanings of these events that are happening, these new events that are happening in their life. A person's cognitive capacity, and these are the information processing abilities of a person reflecting both innate capabilities and situational constraints. Inference refers to the evaluation of uncertainty using related recalled experiences. Illusion refers to beliefs constructed out of uncertainty. Adaptation reflects biopsychosocial behavior occurring within a person's individually defined range of usual behavior. And the last two concepts are introduced later on in the theory. I'll go over it in just a second, but Mishel published a second version of her theory in which she introduced the concepts of new view of life, and that refers to the formulation of a new sense of order, resulting from the integration of continual uncertainty into one's self-structure in which uncertainty is accepted as a natural rhythm of life. And then the other concept that was introduced later on is probabilistic thinking, and this is a belief in a conditional world in which the expectation of continual uncertainty and predictability is abandoned. And these last two concepts are key in gauging how the person is doing, coping with the illness. So the origins of the theory, Mishel was inspired by observing her father's behavior. He was diagnosed with cancer, and during the treatment, she noticed that he was acting differently. She was focusing on things that she deemed to be unimportant compared to what was affecting his life severely. She later on did some research into this idea, receiving some national funding while she was working on her dissertation. And this research would lead to the original theory, which was published in 1988. The theory was then adapted into a scale that has been used to evaluate patients and their families after being diagnosed with an illness. Mishel would later revise her original theory, changing some of the key concepts based on continued research. The type of theory that this uncertainty and illness theory is, it's an information processing model, and these have been around since the 1950s. With the introduction of computers, not as we know them today, but very basic forms that were around back then, researchers, cognitive psychologists specifically, started to explain a person's thought process similarly to how a computer is given information or input is placed into this computer, and it processes the information, gives you results. So looking at the usefulness of this theory, Mishel's theory has been adapted into a scale that, like I mentioned previously, has been used to evaluate patients suffering from chronic illnesses. The scales have been further expanded to include not just the patient, but parents of pediatric patients and family members of patients that are suffering from a chronic illness as well. The usefulness of the theory is also evident by the fact that it's been translated into multiple languages, and it's still in use in multiple countries outside of the United States. The theory itself originated from Mishel's research and has led to more research, both from Mishel herself and other researchers. She continued to verify the assumptions made by her original theory, and this led to the reconceptualization that she published a couple of years after the original. So she looked at a couple of the key concepts and realized that she wanted to expand a couple of pieces of it. And the theory was expanded to include the idea that uncertainty may not be resolved at any point in the disease process of the patient, but may become part of an individual's reality. So having the individual accept this idea is pretty key to their well-being, mental well-being, which will influence the outcome of the treatment. So Merle Mishel's uncertainty and illness theory is highly testable, it's effective, and it's a useful tool that's used to determine the ability of somebody that's suffering from a chronic illness to cope with the changes brought on by their disease. It's been proven to be valid for multiple populations spanning vastly different diseases. It's been used to evaluate the way that a person that's been diagnosed with different types of cancer is coping with the illness, with HIV, with multiple sclerosis, myocardial infarctions. In addition to that, it looks at both pediatric patients, it looks at adult patients. It can be used as a tool to evaluate entire communities as well. So it's very, very, very broadly spanning. As healthcare providers, we have to understand our role in guiding patients along their path and their understanding of how they need to adjust their expectation of life with this illness that they've been diagnosed with. So thank you for watching. I hope it's been informative.